Currently, some of the trends going on in physician practice management for physicians and managers is things that you are hearing generally: declining reimbursement, increasing expenses, difficulty in recruiting both staff and physician to practices, and the uncertainty of the changes in healthcare regulation.
Well, right now there has to be a consolidation in the market with given healthcare reform and understanding there's a lot of fat being taken out of the system.
Perhaps one of the most pervasive and significant trends that we're seeing in physician practice operations today is the movement of physicians back to being employed by hospitals and health systems. We saw this in the 90s in a large way, but then we saw a lot of health systems spin those physicians out into independent practices. One of the things that is a real challenge for hospitals as they employ more physician practices is that typically hospitals will account for those practices in an acceptable way, but which shows that the practices lose money. As the hospitals employ more physicians, those losses can mount and be substantial amounts of money for the health system. So one of the things that we try to focus on with health systems is to fix the areas of their physician practice operations.
Yeah, I think some of the most significant trends in the physician practice management arena that both managers and physicians have to recognize and deal with if they're going to be successful are that the public and the government both are in agreement about a couple of things. One is healthcare is too expensive and it's not accessible enough to those that are not only uninsured, but those that want the care and can't get seen when they want to get seen by whom they want to be seen. So I think one trend is the public that used to hold doctors in high esteem now are beginning to question, was I treated appropriately in that visit? Did I get the appointment that I wanted when I wanted? Did I wait too long? Did I get enough time with the doctor in the room? So patient satisfaction trends and measuring whether patients are satisfied with a doctor visit, something new to this industry, the physician practice management industry. So one trend is starting that's happening is there are more and more physicians, especially in metropolitan areas, where competition is now a factor.